Hello, everybody. I'm so excited to see all of you here right before spring break. Very impressive. You get extra credit in my heart. You're not taking a class with me. My name is Justin Blomquist. I'm in clinical psychology and the psychology department. I'm really, really excited to have my colleague and friend, Dr. Taryn Myers, coming from Virginia Wesleyan. I get the pleasure to introduce her, and I'll read the standards of comportment for CLP and then pass the baton over to her. She'll share about her research for roughly 25-30 minutes, and then I'm gonna ask her a lot of questions. And then I also want during that time, you guys to, if a question comes to mind in the process, please raise your hand and it'll just be like a give and take with all of us, okay? So, and the reason why I'm standing over here is because this light is shining right in my eyes if I stand a little bit over, so introducing Dr. Myers, very excited. So she is a professor of psychology and chair of the psychology department at Virginia Wesleyan, where she is also a member of the Gender, Women, and Sexuality Studies program. She received her BA in psychology with an interdisciplinary minor in women and gender studies from Kenyon College. And I forgot to ask you, you know Lisa Gross.
Yes, I do.
Very well. Yeah. She earned her PhD in clinical psychology at Kent State University, where she served as a teaching fellow and assistant director of the psychology clinic. Dr. Myers completed her clinical residency at the Medical College of Georgia and the Charlie Norwood Veterans Affairs Medical Center. Dr. Myers has served as an editor of Body Image and Sex Roles, as chair of the Eating Disorders and Eating Behavior Special Interest Group of the Association for Behavioral and Cognitive Therapies, and as director of academic effectiveness for Virginia Wesleyan University. She was the 2017 recipient of the Early Career Achievement Award from the American Psychological Association, the 2018 recipient of the Samuel Nelson Gray Distinguished Teaching Award from Virginia Wesleyan, and the 2019 recipient of the ABCT, which is the Association for Behavioral and Cognitive Therapies Women's Issues Special Interest Group Early Career Award. Her research interests include risk and protective factors for body satisfaction and disordered eating. She's published over 25 articles and many conference presentations, and her work has been cited over 2,000 times. I don't know if you knew that. So can you please welcome Dr. Myers? And you have to read this one.
Yeah, go for it.
Okay, so does anybody know this verbatim by heart since we've been to so many CLPs? Okay, so CLP events are part of the university's Cultural Life program, which provides opportunities for students to participate in a variety of educational and enriching cultural experiences. Through these events, students encounter a spectrum of issues, ideas, opinions, and artistic expressions from various disciplines and cultures. CLPs invite meaningful dialogue, leading to a healthy understanding of and respect for differences. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of the university. All participants are expected to display respect for the presenters, performers, and audience members, keep an open mind in the presence of new ideas and opinions, and conduct themselves with civility. In turn, all presenters are also expected to encourage productive and responsible conversation consistent with the mission and the values of the university. Before this event begins, if you can please silence your cell phones and any things that will distract us. Thank you so much.
Thanks. All righty. Well, thank you all so much for coming out the day before spring break gets rolling. I very much appreciate that. And I'm going to be talking about eating disorders and body image a little in general at the beginning, and then talk about my more recent research where I'm focusing on diverse samples. A lot of the research that's done in the subfield of eating disorders, unfortunately, focuses largely on what we call convenience samples: white, cisgender, straight, middle class, college age women. And so we need to find out what's going on with folks beyond that. So over 80% of women in college settings actually report body dissatisfaction. And body dissatisfaction itself is associated with many different negative psychological consequences, including depression, social anxiety, sexual dysfunction, and eating psychopathology. And in fact, in multiple studies, it's been considered as a major risk factor for eating disorders. And so what are the eating disorders? For those of you who are not psych majors, I thought I'd go over the criteria just really quickly. There won't be a test, I promise. She'll be good. And so what comes to people's mind, I think, when you think about eating disorders is probably anorexia nervosa. So this is people who are intaking very small amounts of calories. They have low body weight. They have a fear of gaining weight, or even if they're not fearing gaining weight, they engage in behaviors that prevent them from gaining weight when they are underweight. And a common thing across all the eating disorders is this disturbance in how they see themselves and an over-evaluation of their weight and shape in their self-worth. Now, this is just called anorexia nervosa, but something that is more common, ironically, even though it's called atypical anorexia nervosa, is having all these symptoms but not being low weight. And it still has all the same physical side effects. And so I think it's really important to keep that in the back of our minds, is that there are people who have these symptoms who are not going to look skeletal. And in fact, that occurs more often, even though it's called atypical. Bulimia nervosa is binge eating a large amount of food in a short amount of time with a sense of loss of control, and then purging it in some way. A lot of people think the purging is just vomiting, but it can also be abuse of laxatives or diuretics, which are water pills, excessive exercise, or things like fasting. And again, they're worried about weight gain. They have to do this once a week for 3 months, and that it's self-evaluation based on weight and shape. Binge eating disorder is essentially bulimia nervosa, but without the compensatory behaviors. What I tell my students when I talk about it is I actually like how they break down the binge eating episodes and the criteria, and I kind of hope eventually they copy paste this over to bulimia. I just think it's more helpful diagnostically. But essentially, they are not engaging in those compensatory behaviors, but they still do have distorted visions of their own weight and shape. Now, there are a whole multitude of health risks associated with eating disorders, which I think a lot of people don't necessarily know about. So cardiovascular complications. People who are young will die of heart attacks with an eating disorder. Low body pressure, or low blood pressure and body temperature. They'll have lowered metabolism. Something people don't know is when you eat less, your metabolism actually slows down to try to, your body likes homeostasis. It's trying to keep you alive. So like intermittent fasting might not work as well as people think, right? Fluid and electrolyte complications. Clients that I've seen who are very underweight don't like to drink water because you can see it when you're very thin, right? And related to that, dental problems, particularly for people who purge. The stomach acid is acidic. It can wear away your tooth enamel. Lanugo are these little downy hairs that will grow on parts of the body that don't normally have hair. Typically only babies have this. And this is your body trying to compensate for the fact that you no longer have enough body fat to keep you warm. Your menstrual cycle might cease. However, so many uterus having people are on birth control now that you don't always see the period stop. And then possible permanent damage to bones in the reproductive system. So we're talking young kids having osteoarthritis, osteoporosis. What is most important is that people don't realize that eating disorders are the #1 disorder, psychiatric disorder, in terms of mortality rate. So nearly a person dies per hour from an eating disorder. And then over 70% of folks with an eating disorder just will never seek treatment, either because they don't think they have a problem, they think this works for them, or because it's hard to access care. Now, one of the things I've done a lot of my research on is the role of media. And why do we want to study media influence? Well, as you can see, we spend a lot of our time with media, right? Whether it's on our phone, on social media, watching TV, streaming TV now, right? And we know that media use predicts body dissatisfaction, a drive for a desire to be thin, and symptoms of eating disorders. One of the variables I've studied quite a bit is thin ideal or appearance ideal internalization. The idea that you get this media image in your mind, you think, I have to look like that, and you judge yourself based on whether or not you match up. And in fact, social comparison, comparing yourself to other people on the basis of appearance in particular, seems to be the primary basis that this happens, and is really linked with body dissatisfaction as well. So what am I talking about when I talk about media? Well, we're bombarded with this every day, right? Whether you're online or flipping through a magazine, watching TV, right? We see these very thin images and ads telling us you gotta lose weight. And men, you're not off scot-free, right? You get exposed to this stuff all the time too. I love the lose like a man, right? You has to be like a man. Superhero movies and health magazines, right? So one of the things that I've always wanted to do is figure out what can protect against this, what can help people not to experience eating disorders. And so I study feminist beliefs, holding feminist beliefs, endorsing them as a possible protective factor against body image disturbance and eating disorders. And so feminist theory says that people of all genders are equal, right? The original theory said women are equal to men, and it criticizes and rejects that thin ideal. It says we shouldn't have to all look the same. And so past findings have been really mixed. They've said, okay, maybe there are some relationships that suggest it could be protective. And my own research tends to show that it's an alternative way to understand information about your body, but feminist women are still critical of their bodies. And so feminist beliefs will moderate or partially explain the relationship between media attitudes, media exposure, and that internalization of the thin ideal. And so here you can see where people who have lower feminist beliefs are scoring higher on thin ideal internalization when they're consuming more media, and people who have high feminist beliefs are still higher than those who aren't consuming as much media, but there's a buffering effect, right? I was telling some people today that when I presented this was my master's thesis, the women on my committee said, we really wanted this to work more. And I said, I did too. But that's about as good as we're gonna get, right? And some of my other research has been even more disheartening. So this was, if you make an upward comparison to someone you think looks better than you do, regardless of your level of feminist beliefs, you're gonna have the same amount of body dissatisfaction. As you can see, that's essentially the same data point. That's not great. And so one of the things that I've been stumbling into is that sometimes it's having this really weird interaction with media. And we know from decades of research in our field, because one of the things we do over and over in our field is expose people to media images and then see what happens, that even brief exposure to media images can make you feel worse about your own body. Well, when we're asking women or other people who are feminists to critique the media, they still have to stare at it, right? So we are thinking there's something going on here. And one of the things that has informed my opinions on this is there's some really interesting studies where they've put disclaimer labels on things that are photoshopped. This image is photoshopped. This part of the body has been altered. They did a really interesting study where they used technology that will track where your eyes go. And when they said the stomach has been altered on this image, people's eyes immediately went from the caption to the stomach, right? And so even if we're told this is not something you need to be looking at, it might make us look more. So is this happening? Well, I decided, again, I'm trying to look at not just college-age women, right? And so I used something called Amazon's Mechanical Turk to look at this initially. Unfortunately, MTurk sampling is largely white. And what I found is that media pressures did predict an ideal internalization, but I didn't see that same buffering effect I did before. So one of the things I was doing is I just said, let me just run a regression. And I noticed that when I put in feminist beliefs after I put in, media pressures after I put in feminist beliefs, this relationship disappeared. And so what I am discovering is there's this false thing you'll see in some of my data where it looks like being more feminist makes you internalize the thin ideal more. It's like, what? That's even worse, right? But when you put in media pressures, that relationship between feminist attitudes and thin ideal internalization goes away. So what it's doing is kind of relating back to that theory that when you look at the media more, even if you're being critical of it, that's what's going to lead to it, right? And so then I started to say, okay, so I got a non-undergraduate sample, but they're mostly white. Who else can I look at? How can I flesh this out? And look at those feminist beliefs as well. And so in general, who has eating disorders? Well, the diagnostic manual we use says up to 5% of people have an eating disorder, but that's usually based on people who seek treatment. And we just said 70% of people don't even come in for treatment, right? So this study in 2022 looked at the worldwide prevalence. And as you can see, it ranges quite a bit, but we're looking at up to 6% of women with anorexia, 3%-ish with bulimia, 6.1% with binge eating disorder, and then sort of the other eating disorders, up to almost 12%. And one of the things they said in this article is gender and sexual minorities were at a particularly high risk for eating disorders. So when I've looked at this in the past, what I found is somewhere in the order of 25 to 33% of my sample. So a quarter to a third of my sample meets criteria for an eating disorder. These are just college women in most cases with snowball samplings of some college women and some women that people just knew. That's a lot more than 5%, right? And that's even more than some of those stats we just looked at. But what about in these diverse samples? So I did, this study with several colleagues at other institutions around the coastal Virginia area. And we were able to look at specifically African-American and European-American folks. And as you can see, pretty close match. And what we found is in this sample, 21% met the cutoff for a probable eating disorder. More women than men, more European-American women than African-American women, but still quite a few people. I tried that same mediation because I found the same feminism is predicting body dissatisfaction. And I was like, no. And again, media pressures, media exposure is explaining that. You put in media exposures, this relationship disappears. Okay, well, let's look at sexual minorities. Lesbian, gay, bisexual, queer identified people. And so I recruited these people via an optimization program or MTurk. Here, I found that almost 39% of the sample met criteria for an eating disorder, both male and female here. And those who met criteria for an eating disorder scored higher on internalized homophobia, which in turn predicted more eating disorder symptoms. So that experience of discrimination is relating here. The same Relationship. Yep, that's predicting more thin ideal internalization. What is going on? Oh, it's media. Right? You're paying more attention to the media as a feminist. That is increasing your body satisfaction, your thin ideal internalization. So this past summer, I did one on gender minority individuals. And I used a new sampling software called Connect by Cloud Research. I really enjoyed it. I will be using it again in the future. It was interesting because I contacted them and I said, do you have any idea like how many trans and gender minority individuals you have in your data set? And they said, we have no idea. So I said, how many people do you have in your data set? And they said 20,000. And I said, okay, well, recent studies are showing 5 to 7% of people identify as gender minorities. So you should have more than enough for my study of 300. And I got it, no problem. So there were 308 individuals, and you could see all the different ways that they identified for their genders. You might be like, but some of them are just identifying as men or women. Those were part of the folks who identified as trans. So a little over a third of my sample identified as trans, but others were identifying as intersex, genderqueer, gender nonconforming. And here again, about 29% of the sample met criteria for an eating disorder. Those who met criteria for an eating disorder had more gender dysphoria, less gender congruence. They really didn't feel like they matched with what they were assigned, more gender specific body dissatisfaction, and they wanted to change more about their bodies. Media consumption and social comparison both predicted more gender dysphoria, and those who scored higher on those measures of gender dysphoria also scored higher on measures of body dissatisfaction and disordered eating. And then I compared those, a little over a third who identified as trans to folks who did not. And the people who were trans had more body dysmorphia. They wanted to change more about their bodies. They felt they had more family and peer-related pressures about their bodies, but they were higher in appearance self-esteem. Good for them. That's great. Nothing related to feminist beliefs was replicated here. This is a unique sample. We're not finding the same relationships, and that's okay. Sometimes those are the coolest findings. It's like, oh, this doesn't replicate here, right? But those who self-identified as feminists experienced more gender dysphoria, more body dissatisfaction. So again, something else is going on here. And those who self-identified as trans scored higher on measures of feminism. Now, the next thing I'm going to talk about is, okay, so we're kind of looking at what might be protective. How do we actually fix this, right? And there's lots of different ways this has been addressed. But one of the things that I wanted to look at empirically is what you all are doing today. And so writing on those Post-it notes, a powerful or something you like about your body, does that actually do anything? So I did this study where I had them complete some online questionnaires when they scheduled for an in-person time slot. They came in person and took some measures. They wrote something they liked about themselves, and they were randomized to either write something specifically about their appearance, or I would say, write about something other than your appearance. And then they were also randomized as to whether the picture we took of them with that statement would end up on the Psychology Instagram account, which now I think has a grand total of like 200 followers, or their own Instagram account. And then a week after, they did another set of questionnaires. Now for women, I was able to get quite a few of them. I had 80 women do this over the course of a couple of years. And so these were undergraduates. You can see their average age is about 21-ish. And decently diverse, because my campus where I did this is about 40% individuals of color. And again, these 4 different groups, they either wrote appearance-related statements and posted them on their own, or on the psych one, or wrote non-appearance related statement and posted it on their own or on the psych Instagram. And so what we found out is that when we looked at appearance self-esteem, how they felt about their bodies, it was stable from week 1 to when they came in person before they did anything. That's sort of what we would expect, right? We haven't done anything to try to change it. And then after we had them do the intervention, write the statement, take the picture with it, it went up. And that increase was maintained after 1 week after the interview. There was no interaction for the prompt. It didn't matter if I told them, do it about your appearance, don't do it about your appearance. But there was a surprising result about where they posted it. So people that posted it on their own Instagram felt better about it. And this surprised us, but our only thing we can think of is they felt like they had more control over the posting than when we posted it. I tried to do this in guys. I got 14 men. Woo! And then COVID happened. So that was part of it. But I tried like very hard to get more guys, and it was really hard to recruit. And they were more whites. We didn't quite find as much diversity here. And so I analyzed the whole sample instead of the groups, because the groups had like 3 people in them. And what I saw was there was a trend to decrease in body dissatisfaction from pre to post in person. But as you can see, it's just like, it didn't really change. It went right back up, right? And again, I think that's partially because I had a really small sample here. But also maybe this needs to be addressed in different ways in men. Okay, so what does this all mean? So eating disorders and body image disturbance are not just a thing for European American, straight, cisgender women, right? Especially not just women like yourselves and men like yourselves in college populations. And it's imperative to study these issues in diverse samples, including whether interventions are working in those diverse samples, right? We need to see, like, is an intervention like this going to work in folks who are, gender minorities? There may be ways to mitigate these effects. Feminism? I don't know. The findings are really weird, right? But also these interventions. So these interventions are called cognitive dissonance interventions because by forcing yourself to write something positive about yourself, you are creating dissonance in your mind with the overarching societal idea that everybody has to be criticizing themselves all the time, right? And that dissonance works more effectively than just telling people, feel better about your body. Feminist beliefs are, again, they're increasing this attention to media images, and that's explaining this relationship, at least statistically, right? And I just want to give a couple quick thanks to the folks who have worked in my lab over the years. Dr. Robert Ariel has taught me how to use all the online things, and I appreciate that. Dr. Casey actually inspired me to get into looking at the gender and sexual minority folks. And then I've gotten some funding through Virginia Wesleyan. So thank you all very much.
All right, thank you so much, Dr. Myers, for I feel like we're gonna need 2 ferns or something.
I know.
So thank you so much for sharing about that. I'm just so curious about how the feminist beliefs could be protective.
Mhm.
Like what beliefs may actually, if we didn't have this pure, media pressure, like what should be helpful?
That's such a good question, and that's something that I have looked into. I actually refer to those studies as calling myself on my own bullshit because I've just sort of explained that as well, here's why. here's why it's working, right? But I never tested it empirically. So I looked at things like media literacy. I looked at things like critical thinking. And like nothing really worked except for if you looked at like the interaction of some of those variables with just self-identification, saying you're a feminist or not. Other research has shown that just saying, yes, I'm a feminist is a lot more powerful than scoring high on a measure of feminist beliefs. So I still don't really know. But yeah, it is a good question. And, like in my mind, it is this like ability to critique things and like value yourself for everything that's going on. But I don't know that I'm showing that with this research. So I think I need to like keep analyzing and see if it's related to something like self-acceptance, maybe things along those lines.
And so, one of the things that you found is that it was associated with greater gender dysphoria.
Right.
And
Yeah, it's probably again like similar in that, one of the good things is there is now more media representation of trans folks, right, and other gender minorities. But like if you're looking at that, right, it's often sort of one body shape of trans folks, right? It's like people who pass, right, and are often very slender, or if they're passing for trans masculine, they have the triangle, right, that we expect men to have. And so if that's the only thing you're seeing, right, that might be part of what's going on. It also could just be if you're more feminist, maybe you're more likely to like realize that you're trans or accept that you're trans. I didn't have measures of that per se. And then you're just like, if that makes sense. And so then you're going to experience gender dysphoria, not necessarily because being feminist makes you gender dysphoric, but because like you've now realized and accepted that you don't fit into the gender binary. But yeah, I don't have a good explanation because I haven't looked at it empirically yet. That'll be like the next study.
Yeah, and I just want to, if you guys have an explanation,
feel free.
you folks have an explanation, we would love to invite ideas there. Okay, so, one of the, thoughts that I had was that media pressure can be for the kind of appearance ideal for women and for men, but then there's also, but that's really a heterosexual ideal.
Right.
And so then if you add in sexual minority ideal, that can add, and just another ideal that people feel like they need to match. And so I was wondering if another reason why feminist beliefs are associated with higher appearance ideal and internalization could be that they're having to navigate more pressures,
Right.
Pressures from maybe their kind of the heterosexual community and the sexual minority community.
Yeah, and I think that's where that like peers and family pressure that I mentioned on the one slide came in, right? So like, yeah, if you are open, if you're out, right, and you're not straight, people are gonna maybe have a problem with that. But even if they don't, right, then you're gonna get pressures from, like your parents might be like, oh, well, don't you just want to wear a dress, dear? Wouldn't that be nicer, right? And again, yeah, like your peers, and I don't know if those are peers within or without of the LGBTQ plus community, right? Like they might have pressures in different ways. So like, for example, I know people that are bi or pansexual, if they are dating someone where it looks like a heterosexual relationship, right, they'll get critiqued from within the community. And then if they're dating someone where it looks like it's not a heterosexual relationship, they'll get critiqued from outside the community, right? So it's like they can't win sometimes. And then, I mean, let's say you're bi or pan, you are navigating like everyone's gaze, right? And one of the things that's been found in research so far is that like people who are subjected to the male gaze in particular feel a lot of these things, right? But unfortunately, Jean Kilborn, who's like got a really great series, she has a TED Talk related to this, just like how the media portrays folks, called Killing Us Softly. the way she explains it is, this is not the gender equity I was fighting for, but like now we're seeing men being subjected to it from the
Right.
female gaze, and it's like, that's not the direction we wanted to go.
Yeah. So true. Okay, so what recommendations do you have for future body image research with regard to studying intersectionality? And why does it matter to study intersectionality? What is intersectionality again?
Good question. So intersectionality is thinking about a person's whole identity. So, you know, I am not just a straight European American woman, right? I'm also cisgender. I'm also straight, right? I also am someone who experienced a mental disorder because I had postpartum depression and anxiety after giving birth, right? And thinking about all those things together. Yeah, so like, you know, I did a teeny bit of that, looking at like the Black women versus European American women versus Black men versus European American men. But what about thinking about people with disabilities, right? I haven't even touched on that in my research, or looking at the research on the gender minorities and looking at how that intersects with race, right? Or even age, right? Is this different for people who are in middle age or older, right? Are they maybe in some cases feeling less pressure because they're like, I don't care what I look like, right? Or are they feeling more pressure because they feel like, ooh, time is running out, right? Like, I can't answer that right now. So yeah, I think that it's really important to look at these things intersectionally. And in order to do that, this research needs good funding, right? Like, I'm not going to get that just like giving people extra credit for doing it, right? So I need to be able to find those specific samples, compensate them fairly for participating. That's a big part of what I've been trying to do on these websites. So if they're doing a 45-minute to an hour survey for me, I want to pay them what minimum wage should be, right? At $15 an hour. And so like, I don't have that money just laying around in my bank account, right? So I need to be able to find sources of funding. And like, for example, my gender minority study, I had to try 3 different times to get even just like an internal grant to fund it, right? And so like, I can't imagine what it'd be if I was trying to do it on a larger scale and get funding through like a governmental source, especially when everything's so controversial right now, and we have things like the Don't Say Gay bill in Florida, right? Like, it's gonna make it harder and harder to do this really needed research.
Yeah, I'm just thinking about, you know, so we really care about intervening, preventing suffering, you know, promoting positive body image and having these different interventions. And most of them have been developed with the white cisgender women, college age women. And that just doesn't fit everybody, and it can be harmful. And the thing is that sometimes we don't even know if it's harmful because we haven't even asked the questions. And so it is really important for us to actually examine the complexity of humans as opposed to just assuming everybody fits this box. Yeah, because like, I know that you run the groups for the Body Project and More Than Muscles here, and those are great programs that have a ton of research behind them, but like, how diverse is it? I don't know. Like, I know they were started with sororities largely, and we know the sororities can be diverse, but are they that diverse, right? And so, yeah, we need to be asking those questions, and we need to be looking at, does something that we have a manual for that was normed mostly on white women, can we take that manual and apply it to someone who, like, one of my first clients is Muslim and wears a hijab and had an arranged marriage, right? Is the same stuff gonna apply to her that applied to sort of your average white American, sort of middle class Eurocentric woman? We don't know because no one's asked in a lot of cases, and the field is slowly getting this, right? That we need to address this. But there's been a little bit of like hubris, I guess, where people have been like, well, these work, so of course they'll just generalize, right? And it's like, but will it? Right? And this is why you see things like, so like, I'm on like therapist Twitter, which also is related to like people who are clients talking. And there are people who will talk about very empirically supported interventions, feel like they're being gaslit by their therapists. Because a lot of these interventions tell you to like
question your thoughts or your negative thoughts. But what if my negative thoughts are, I'm being discriminated against, right? And then they say, well, let's not challenge that. Let's not, because I'm being discriminated against, right? And a culturally sensitive therapist hopefully wouldn't do that, right? But
Right.
I don't know about you, but I only had to have one class on like diversity in grad school.
That's right.
And so like, you can only cover so much in one semester, right? So I'm constantly teaching myself new things
Yeah.
when I prep for my WGSS classes. So I think that there's a lot we need to do, and there are people who are hesitant to do it because they just assume it will work. And I don't think we can do that as a people.
No, we shouldn't.
Yeah.
Yeah. I'm gonna just, invite any questions from the audience. It's like, yeah.
So I'm gonna be a little bit selfish because I have to run, but
That's okay.
I am, so coming from the perspective of an art historian, so when you talk about media, you're saying visual media.
Yes.
And is this curated by the participant in the study? Is this curated by you?
Good question.
Yeah.
So the studies I'm doing, it's largely general questions about how they consume media. But it's not specific. So like this thin ideal internalization and the media scale, just ask, I think about media in particular, visual media in particular, but they're not differentiating between like social media and TV and movies, right? And so I think that's something we need more sensitive measures for.
So the reason, this is not at all founded in anything, but thinking of intervention measures, I'm thinking about what if you went to a museum that was encyclopedic, so you're not just dealing with European art and that sort of ideal, and people got exposed to that imagery. Also, because I teach a class in the body and I had a Mentimeter up, and so students added anonymously, but we looked at large bodies and I was floored by the responses, as in like the positive remarks. And it was a case, the case study was essentially defining this question, is this kind of, I can't remember what the terminology is, it sounds terrible, but it was like, is this gross or ugly? And that nobody in the class thought that. And I'm just trusting that they answered anonymously, honestly, but that was really interesting, just in a class to expose them to different body types by contemporary. They happen to be contemporary painters that we were looking at. And so I don't know, I would be curious to hear more about that, and then ways in which we can bring more imagery and something that's not maybe photographic and what that does, and also that's more remote created later on. I mean, I think what I'm saying is I think art history has a role in this, and as an interventive measure.
A lot of the ideas that inspired this type of research came from the art historian John Berger, right? So he wrote this wonderful book called Ways of Seeing, and talked about how when a woman is in art, she is watching herself being looked at, right? And how like that's a very different cognitive process than a man just looking at the art, right? And again, we can make that more gender expansive now. But yeah, I think that there is a place for that. And unfortunately, this study was retracted because the guy made up the data. So we could try to do this again, but there was a study where they looked at, supposedly looked at, apparently didn't look at, bases of different shapes.
Oh, yeah.
Yeah, and that, like, let's actually do that study. Let's see if looking at a tall, skinny vase makes you feel worse about your body.
Yeah.
Like, I think that's worth asking.
Well, I think, and just visual literacy, so thinking about asking the questions of what sort of narrative is constructed. So you even brought up, and I don't know if you use the term visual literacy, but thinking about what are the motivators behind that, rather than just looking superficially at the image.
Right.
And so even training people to do that,
Yeah.
I would love to just connect more about this.
Yeah,
But
definitely.
there's a lot that's popping in my head about
Yeah.
that in media and imagery.
Yeah, all my contact info is
Okay.
here, so feel free,
Okay.
anybody. I'm on Twitter till it burns, so, and I'm going to always call it Twitter, not X, so. And my handle shouldn't surprise anybody after listening to that presentation.
And to that point, there is a new model that just came out that actually has included motivations for looking at social media. And because it does change your algorithm, what you were paying attention to is gonna, follow you down. And so you're right, motivation
and the motivators do impact what you end up seeing.
Yeah, and the way you are critiquing, right, is gonna make a difference as
Mhm.
well. But yeah, I agree. We need to look at this beyond just modern media. But that's not what we're not only looking at.
That's not the only thing we're consuming. Yep,
Exactly.
yep.
Any questions from y'all?
It might be kind of like too general, but, as far as like the anorexia versus bulimia goes, if you are working out for like 5+ hours a day, and your reason for doing so is so I can eat whatever I want, what would that be?
It's a very good question, and I should give you the standard clinician answer, which is I can't tell unless I actually interview them myself. But I mean, it does sound like that might be bulimia if it's a binge, right? That being said, it is very typical for someone to go through more than one eating disorder or diagnosis in their life, right? Like, so someone might start with I don't want to say just anorexia, right? Obviously, because it's horrific and all of these are really, they just wreak havoc on your body and your mind. But they start with anorexia and then like you can binge in anorexia, but like a binge for them might be eating like a whole sandwich instead of half a sandwich, right? So it wouldn't be like something we all might think of as a binge. And so, yeah, it's entirely possible that person might be sort of like, they started with one and they're going to another. Like some of my clients that had bulimia, they would like challenge themselves to see how long they could go in a day without eating. And then they binge not only for emotional reasons, but also because they were just hungry. Right? Like sometimes you just get hungry.
So, kind of a follow-up question then would be, so for bulimia, I guess the normal view of it is like either like a normal body weight or an overweight body weight. Can you have people that are severely underweight that have bulimia?
That's such a good question. Typically, no, because what a lot of people don't realize about purging is that it doesn't get rid of all the calories. So when you throw up, I think you only get rid of like half the calories. And people will try to like make sure they get it all out. So they'll eat like a marker food. They'll be like, I'm going to start with kale. So that's easily identified when I purge. And they forget that like your stomach churns things up, right? You can definitely have symptoms like bulimia and be underweight, but typically those are like
So if,
what we would call subjective rather than objective binges, smaller binges.
so the purging is with exercise.
Exactly. You can be doing excessive exercise, but you can also have someone with anorexia who is excessively exercising, but just never binges. Yeah. And I mean, there are some people in our field who argue that like, these are all just like false, like dichotomies and that we should really just talk about like disordered eating as a whole. But in order for our clients to get their insurance to pay for their care, we have to slap a diagnosis on it. Yeah.
I know it's not completely black and white, but I'm wondering if you think that things like romantic relationships could be more of a risk factor or protective factor, because I can see that connection being important and strengthening, but I could also see like, oh, not only are they looking at themselves at social media and comparing, but they're like, is my partner also comparing me to other people on social media?
Yeah, and I think that more modern versions of the scale does look at like significant others, the scale that asks about like peer and media pressures. So yeah, I think it, as you kind of said, it would, being in a relationship itself wouldn't necessarily be the risk factor. It'd be like how much support or critique you get from within that. Do you have any research that looked at that?
I'm just thinking of like interpersonal problems, so like if there's conflict in that relationship, even if it's not body related, that would be a risk factor. But really family pressure, whether it be partner pressure or sibling, adult, child, that can all influence it.
Yeah, and that's something that like for years, because they looked at things from a psychodynamic perspective, they just thought that it was family and particularly blamed it on mothers, right? But then they actually started to look at some of these other pressures and realized that they affected it. I mean, I'm not joking when I say we actually, several of us in my lab had to convince my grad advisor, who's very intelligent, has been in the field for years, that media pressure actually made a difference, because the only thing she watches on TV is Cleveland Guardians baseball and the news. So she wasn't being exposed to it. So finally one day she was like, is it like Twiggy? And if you're not familiar, Twiggy was a very thin model in the 60s and 70s. And we were like, yes, Jan, everything is Twiggy now. And then she finally got it, right? So, yeah, so there's probably other pressures we're not even like realizing at this point in time. But yeah, I think for like friendships and relationships depend on like what that dynamic is, right? Like if you have people who are always building you up, it might be more helpful. Now, that being said, once someone is in the pathology, sometimes it doesn't matter how people try to build you up. They just don't hear it, right? These are very powerful disorders.
And Cindy Bulick has that partner, eating disorder treatment, the anorexia treatment.
Yeah.
That's kind of based on family-based treatment. So there is, I don't know if you know this, Megan, but yeah, so there is a treatment that actually utilizes the partner to kind of help the person get better.
And it's based on the idea that the most empirically supported treatment for adolescents with anorexia nervosa is family therapy, because you need to change more than just the person. You need to change like their whole eating environment. Yeah.
Do you think the healthcare system plays any kind of role in the prevalence of body issues? And how do you think our healthcare system can find a balance between body positivity but also
Good question. I could rant about this for a while. There is bias in our healthcare system in a whole host of ways. You know, there's racial bias, gender bias, but there is fat bias in our system, and it's how they're taught still to this day. They're taught to use BMI, which is a measure that was made to be used on a population level, never meant to be used individually, that has arbitrary cutoffs that have been moved throughout the years, and in fact was made up by a guy who was a eugenicist. We shouldn't be using it, right? So that's part of the problem. But doctors are trained to use it, and that obesity is a health problem in and of itself, right? And so not only does, you know, going to the doctor and them telling you you have to lose weight reinforce what everyone else is probably telling you in your life, right? But it also leads to people stopping going to the doctor, right? To people's preventative care being delayed or not even offered. There are studies that show that like if a obese woman goes into the doctor, they are less likely to be offered like a pap smear or a mammogram, right? And so then it's like, well, are these health issues that we see more in those populations actually related to that, to obesity, or just the fact they're getting ignored? So I talked about this in the WGSS 230 I visited earlier, that there was a study. So the reason they said COVID is more of a risk factor in people who are overweight is because of data from the swine flu, the H1N1. And they went back and reanalyzed that data and found that it was actually time to receiving care that made the difference. So overweight people, it took them longer to get medication treatment because probably their doctors thought it's fine, you just need to lose weight, right? Or they didn't go in because they didn't want to hear that. So yeah, I think that this is something that I every year I'm invited to the medical sociology class on our campus to talk about. And if I can like piece by piece get people in the medical profession to realize that like we need to be looking at actual health markers and not just weight or BMI, then I'm doing my life's work.
All right. Any last questions before we wrap up? We're gonna turn it over to Dr. Casey.
Oh, I was gonna ask a question. There are no student questions. Are you sure? So I'm curious, I know there was a chart where like, under like gender minorities, there are all these different labels that people might use. I think so much more work could be done on that and why people are choosing different labels.
Oh,
And
sure.
Labels evolve over time, over the lifetime of one person. But I'm wondering about people who identify as non-binary and wondering if there's a way in which like stereotypes about appearances are more likely to be rejected by people who identify as non-binary, and I almost wonder if being non-binary could be a protective factor.
I could probably look at that with my data. I haven't yet. That's definitely a question I can ask. Because I can look at the people who identify as non-binary and the other folks, just like I did with the trans versus not. And yeah, I would think like one of the reasons why I was finding more of these factors with trans individuals is that they still feel the need to fit the binary in a lot of cases, right?
Sometimes you're
If you're trying to pass, and unfortunately, that often means you're going for the stereotypical ideal, right? And stereotypical mannerisms, which we know even like playing in the stereotypical gender roles has an effect on how you feel about your body in general. So yeah, that is a question I will ask with my data. I'm curious to see what we find, because yeah, I think that there might be something that if you're like, I don't have to conform, that it might translate over to even my body doesn't have to conform. Oh, hey, do you want to come and do your last couple things you need to do? Thank you all for coming. I really appreciate it.
Okay, cool. I don't have a whole lot to say. If I haven't met you, I'm Dr. Casey. I'm the director of the Women, Gender, and Sexuality Studies program. We were a sponsor of this talk. We had a whole year long, it's not over. We have a whole year long series about the body. This was our 5th speaker, and we have 2 more coming up. So I just want to, do you want to, I'll go back to this maybe? Yeah, okay. So obviously you were at this one, right? And these are the 2 more we have. Dr. Victoria Walcott will be coming here March 21st. The next 2 events will be in Furman Hall. They're always on Thursdays at 5 o'clock. We'll consider changing that if it doesn't work for you next year. We'll do this 2 more years. We'll have a different theme each year. Next year, we're thinking about the theme of belonging, but we'll be doing work with different departments every single time. And so this was a collaboration with psychology. Next month, it's going to be a collaboration with the history department because it is Women's History Month. And ironically, I didn't think about the weird connection between these 2 talks, but the next one is actually going to be about women using hunger strikes as a political tool, starting probably more so with the suffrage movement and going up. So different uses of the body for different purposes. And then we have Evelyn Berry, who just published a chat book called Grief Slut. She's a trans woman who lives in Colombia, who writes in very funny, explicit ways about being trans, and she'll be speaking on campus on the 18th. So just keep those 2 dates in mind. Every event that we do, we put this little survey up because we want your feedback, what you thought about these events, what was compelling, if you actually have more of them or not. So if you can just do a screenshot of this, it's only like 4-ish questions, it's real quick, but it helps us to, get more budgeting and provide this kind of stuff in the coming years. If you found this to be useful, compelling, engaging, if you learned something, if it made you challenge your beliefs, any and all answers are welcome. But feedback is really, really helpful. And of course, just a reminder, post-it notes hopefully kind of made their way across the room, and I don't know where the Sharpies or the rest of them are, but on your way out as you're filling out the survey, if you could stick your post-it note on the mirror. We want to fill up the entire mirror, and we're going to keep this in Furman 112, which is sort of functioning as the WFS space right now. It's right near the ice maker and the elevator, if you know where that is. We will keep this and archive this as a symbol of what we did here today as a community. And then I'm just going to go back real quick and let Dr. Douglas talk about this project that he and I can help with.
Yes, so I'm actually not going to keep you very long. I just wanted to make sure that you knew that we have opportunity for you to participate in the Body Project and We're the Muscles. And they are basically opportunities to learn how to push against society's pressure about what society tells us to look like, okay? And so there's a lot of really fun discussion. They're small groups that become really meaningful and inspiring and life-changing. And we have 4 of our peer leaders right here. If you have any questions, please come. It is an amazing opportunity to help family, friends,
be more positive, about their bodies, more accepting about their bodies. And I just hope that our whole campus, really changes with, feeling free to be however we are. And yeah, so please use the QR code and all that fancy stuff. Yeah, thank you guys. And thank you guys.